So today we welcome Dr. Wendy Loretto, a professor of organizational behavior and former dean of the University of Edinburgh Business School. She is an expert in later life employment with a particular focus on changes in employees' and employers' attitudes and practices in extending work lives. She is especially interested in the ways in which gender, health, and age interact to affect work and retirement experiences amongst older men and women. Her current projects include a 5-country study examining the ways in which national and organizational policies intersect with individual circumstances to affect the decisions around extension of work life. So today we're going to be discussing Professor Loretto's paper, Menopause, Work and Midlife, Challenging the Ideal Worker Stereotype, published in the journal Gender, Work and Organization. So welcome, Dr. Loretto.
Thank you so much. And thank you so much for inviting me to speak to all of you on this course. It's a real honor. So
Oh,
the project that I'm going to talk about today that led to that paper is called Supporting Healthy Aging at Work. It was a follow-on from the 5-country study. It only focused on the UK, but it wanted to particularly focus on how work affects health and how health affects work for what we now come to know as mid to later life workers, i.e. over 50s. We used to call them older workers, but nobody likes to be called older. So the term has changed. And the focus of this project was case study based. We worked with employees from 4 different case study settings. That was finance and banking, manufacturing, social care, and then self-employed. The reason we chose the last setting was that in the UK anyway, self-employed is the fastest growing area of employment for people over 50. So it's very, very important. And we really wanted to try and get underneath the skin of health and work. We know that in the UK, a quarter of people who leave work before the state pension age do so because of unmet health needs. So we really wanted to get underneath the skin of that problem to see if there's ways we could support them to work for as long as they want to or as long as they need to. And also, we know that if people leave work what we call early, i.e. before their retirement age, they're more likely to be more dependent on the state throughout the rest of their lives. So we feel that focusing in the scrutiny on health in the workplace for mid to later working life actually has benefits to the individuals and to wider society.
Great. So in terms of this paper today, well, actually, before I ask you about that, just tell me why you decided to take a qualitative approach to addressing these kinds of questions. What appealed to you there, and why did you think this would be most effective?
Yes, it's always a conundrum, isn't it? You know, what methodology you're going to adopt. And I think there has been some qualitative work. So we do know the statistics, you know, how many people are leaving work, what sickness rates are, etc. But we don't know the why. And for me, that's where qualitative can really help us interrogate the why, the how, in what circumstances. It was those sorts of questions that we really wanted to ask. And I think for me, the qualitative approach is much better for those.
Well, so you managed to collect a very large sample of
Yes.
156 60 to 90-minute interviews. That is a lot of data.
Yep.
So for this, yeah. So for this project, for the manuscript we're sort of looking at today, you used 80 interviews out of those 156 for this analysis. Um, so let's talk about samples. So how did you decide which interviews would be used for this project out of the
Okay.
156?
So if I start maybe from the beginning and say, how did we come up with 156? We were aiming for 40 from each of the 4 sectors, and we got obviously slightly just slightly just under that, if you can do the math, which I'm
Yeah,
sure
you did
everybody
it.
can.
Yeah.
But we were still very pleased with that. And we wanted in qualitative work, we're not doing representativeness the way you would be in a quantitative sample. We're not looking for, one person who's, male of a particular age, working in a sector of particular experiences in a cell as such, but you're wanting to have that representativeness overall and thinking, what is the right sort of number that will get me a range of experiences? So one of the things you said in your introduction is that I'm very interested in how gender intersects with age, but I'm
Mm.
interested in all that that brings. So it's not just gender. There's ethnicity, there's home circumstances, there's caring responsibilities, all of those sorts of areas that we want to cover. So in working through all the different experiences and intersections of experiences that we wanted to capture, we thought about 40 in each case setting would be good. Case settings were chosen to get diversity as well. People in banking tended to be white collar work, relatively well paid, good pensions. In manufacturing and engineering, it ranged from everybody through people on the assembly lines with welding torches to highly qualified computer engineers. Social care, of course, is mainly women. Mainly female workforce tends to be low paid, low educated, and doing really hard physical and very often precarious work. And the self-employed, we wanted to really capture a range of characteristics there that perhaps we didn't capture in the others. So we actually chose a low income self-employed group, and we chose a group of highly variable ethnicity as well to try and capture different routes into employment. So that's a bit of background about how we got the overall sample. I guess choosing the 80 for this paper was slightly easier. These were participants with direct experience of menopause. And for this, in terms of this, everybody identified as a woman. They were cisgender. So that was how we got the 80. It's not to say that the men didn't talk about menopause. And actually, if you do go into the data set, you will see that some of the male respondents talked about this. And in fact, in manufacturing, they were very interested because, as it turned out, a lot of people said to us, actually, I'm really pleased we're raising the profile of menopause because I've not known how to have a conversation with my wife or my sister or, some other friend. So actually, men talked about menopause, but for this, when we were really wanting to analyze direct experience of going through menopause, including perimenopause and postmenopause in the workplace, we focused on women. So that's how the 80 came out.
Wow. Okay. So in finding these people and recruiting them into your sample, what sort of challenges did you have? You managed to meet your recruitment objectives pretty well. So what was hard about recruitment and what worked well for you?
Yes, so we had with different challenges or different challenges in each of the different sectors. I have to say the easiest one to recruit in was the manufacturing. And I think there we had a very enthusiastic HR manager who was our primary contact, and she put out requests to participate in all sorts of channels, and we got a good response back. And then there was some snowballing from there. I don't know if you're familiar with the term snowballing, but it's as you think about it, you get someone and it then captures more snow or captures more people, so people refer others. In the bank, we actually had too many people. So, you said it was a big data set, and it was, and it is for qualitative data, but we could have had 4 times that just from the bank alone. I think we had 180 people came back to us. So we actually had to instigate some form of selection. So, for example, we had overwhelmingly women came back to us. So we prioritized where men came back because we wanted to have some sort of representation of men. We um we didn't want to disappoint. people who had offered that we just didn't have the resource to interview. So what we did was we did a little parallel survey to everybody. So we actually have a lot more responses from the bank, believe it or not, which was really interesting as well. In social care, that was tricky to recruit in because, as I said, that the nature of the work and the workers in that sector meant that we had to try a lot harder. So I did a recruitment video, for example, that was shown to them in a training day. Again, we did lots of snowballing, but also we decided with that sample, because these are by far the very much the lowest paid people, that we actually offered a small incentive, so a supermarket voucher for people who participated, and that helped us get our sample. Self-employed, again, a different challenge with the self-employed. We had originally budgeted in the grant for a recruitment agent that would help us, would help go out and recruit. That failed spectacularly. I don't think we got anybody through them in the end. So that's maybe a bit of a warning if you're thinking that helps in terms of recruiting people for these sorts of projects. So what we did was we used some of our contacts in England, in Manchester. So this project was covering the whole of the UK. We used it in Manchester, which is a very large town in the north of England, and has a very sort of active programme on ageing and everything from healthcare to do with age to employment. And they had started a particular initiative which was supporting older self-employed people.
Mhm.
So we were able to work with the organizer of that initiative and recruit through that, and that's how we got our self-employed sample.
Now, who was when you say a recruitment agent, what kind of person is that?
That is again. I don't know if they exist in the US, but it's specialist agencies who will actually recruit for research projects and other. That I think they'll probably recruit for things like market research as well as academic research. But what they do is that you pay them a price, and then they go out through their networks to get people. If I can be a little bit candid about it, I think sometimes they do things like stand outside supermarkets and try and sign people up. I'm not sure, excuse me, if they're always very sophisticated how they do it. But we had used them in a previous project when we wanted to recruit people who had become unemployed, and that worked very well. But for this project, it wasn't the right thing to do at all.
So who were the people that you had recruitment success with this group?
With this group, it was a government initiative through our it's called the Department for Work and Pensions, which in the UK administers the welfare benefits and is the government department that is concerned with keeping people in employment and getting unemployed back into employment. And they had put some money into an initiative to help support older people over 50, into self-employment. So it was the organisers of that initiative that actually went out to their members and helped us recruit.
Well, that's incredibly valuable information because, you can waste a lot of time and money if you have recruitment efforts that don't pan out. So that's
I
great.
absolutely agree. And I think that is one of the challenges about qualitative, and making sure as well that you get a really good diversity. I can't emphasize that enough.
Yep, absolutely. Yeah. So in terms of the interviews that you conducted, some were online, some were in person. Um, what did you find in terms of these two different modalities? Were they different? Was the data different? Was the experience different? What was your experience?
So I think we anticipated there were going to be huge differences, and in practice they weren't. So we started collecting these data in autumn of 2021, which was why we had to pivot online. The UK was in lockdown again at that time. And I guess we were if you could argue, fortunate in that people at least were quite experienced in terms of, being on Zoom or Teams or some other online platform. So we're a bit more at ease with being interviewed online. We had anticipated that there would be, it would be more difficult to establish a rapport. I mean, we're asking about quite sensitive issues in these interviews, but actually it was remarkably easy to establish rapport. Uh, and so it really wasn't very different. And the data we got, I wouldn't, going into the transcripts now, uh, without the marker that says whether they were online or in person, I don't think I would know the difference. We had very experienced interviewers as well, but maybe I'll come on to that a bit later.
Yeah, you
So
had 9 interviewers.
yes,
Yeah,
yes, yes.
that's a
I,
lot.
it is a lot. I was going to say, just to finish off I certainly wouldn't be put off doing online again. I would do that because the advantage is we actually included a wider geographical dispersity than we might have been able to do if we had we focused solely in person. So no, I wouldn't be put off that. And in fact, the second part of the project, which I'm not really going to speak about today and is not in the data set, but the second part of the project followed 50 of these original 156 over a year and did quite intensive co-design work with them to try and help um, design solutions to be implemented in the workplace. And that was all done online and worked very well. So, so yeah, I would say online. I would have no hesitations. We'll maybe come back to some tips as we go through. But to answer your question, the second part of your question, 9 interviewers, probably too many in hindsight. I think having multiple interviewers can be a good thing, and in fact, I think is a good thing. We were very mixed age. In terms, I think our youngest interviewer would have been in her 20s. I was the oldest interviewer, so ranging to later 50s. We had men and women interviewing, and we had people from different disciplines. So I think again the diversity was good. 9 was maybe, I think 5 would have been probably a better maximum, because with more than 9 you get maybe a bit too much diversity in just people's individual interests or lines of questioning. And of course, training the interviewers is very important. So that was quite a number of people to train as well.
Oh, yeah, yeah. Because interviewing is not it's not, there's a lot of skill to that.
It's a big skill, yes, and you can see that. So again, if you go into the data and have a look at the transcripts, you will see some that perhaps flow more naturally than others. I think it really is a skill.
Absolutely. Um, so, let's see. So you collected this massive amount of data. So when thinking about, okay, now I've got mountains of data, I'm going to start to do some analysis. What were some of the first steps that you took in order to make sense out of this massive amount of data?
So we had all the interviews transcribed. And we retained the oral recordings for a year. So that was the requirements maximum we were able to do it under the ethics agreed of the project. So for the initial stages, we had both the oral and the written transcripts. Latterly, it's just the written. And we listened to interviews. I think there's can be a really good advantage in listening to those interviews back or replaying the recording if we did it on Teams or Zoom, and then read the transcripts. And there is no substitute for just going back through. It's the first stage of good qualitative data analysis, that immersion phase. Just get yourself into the data. We read each other's interviews in order to just get a feel of how they were going. In fact, as you can imagine, collecting this volume of interviews, it was really over a year. So we were able to make some tweaks within the project. But in making sense of the data, it was listening and reading. Those were the two areas that really helped us to make sense of the data. We
And
had gone into the interview. We had gone into the interviews with obviously with a semi-structured interview guide, and that was guided by the theory and the evidence in place. We particularly in we wanted to allow respondents to talk about any aspect of their health that they wanted to, but in particular we had a focus on what we called hidden health. less visible aspects of health in the workplace. So we asked questions obviously about menopause, the subject of the paper. We asked about the health effects of combining unpaid care and work. We asked about cognitive aging and cognitive decline, and we asked about financial well-being. But we also allowed for any aspect of health that they wanted to talk about to surface.
And you used when you got into analysis. So I'm assuming you did this immersion before establishing a coding structure, or maybe that was part of that whole process.
It was part. So I think,
Yeah.
when, and I'm sure, everybody watching this knows when you read textbooks on data analysis, it's very sort of absolute and it's very linear. And I think, the reality is much more, it's more messy, basically. So yes, we went in, we had established codes, if you like, that we were looking for around about the areas of hidden health that I mentioned, as well as other codes in terms of what were people talking about the retirement plans, what were their domestic circumstances, etc. But we also wanted for themes, etc., to emerge from the data. So there was some deductive going in with codes that were derived from our theoretical and evidence-based framework, but also the immersion really allows to say, actually, where's the unexpected in these data? We didn't necessarily know that this would come out, but it's very much coming out. And that, for me, is one of the most exciting parts of qualitative.
Definitely. That's one of my favorite questions. What surprises you when you're looking at data? Absolutely. And you use the Brown and Clark technique, which is what we're actually using their textbook book in this course. So how'd that
Brilliant.
work out for you?
Very well. I think for me, it's a very intuitive, the 6 steps in the thematic analysis. And I hope you're all finding that as well. So the first stage we have discussed about the immersion. The second stage, obviously the codes. So for us, obviously coding health and coding the various aspects of health was that natural second stage. So in this case, coding for menopause, and then the subcodes that arise from that could be menopause symptoms, factual things about if somebody had been through menopause, when that was, um, other aspects of how menopause had maybe affected their home life, how it intersected with other things like, that health treatment they had or hadn't had, which was more often, and uh, any aspect of their life really. So the whole range of codes derived from that in stage two. And then stage three, for me, that's when it starts to get really interesting, to say, okay, well, what are some of the themes emerging from this? Because, you know, if you were doing a kind of business type report or a public health type report, you might be wanting to list out all the codes in detail. But for social science approaches, you're much more interested in actually, well, what does this mean? What are the main themes coming out? And for us here, of course, there were themes about, feeling safe within organizations, that level of psychological safety, being able to disclose, symptoms and say, this is because I'm going through menopause or not. The lack of psychological safety again was another big theme that was coming up. And then I guess the next stage was really where the paper, comes in. We reviewed those themes and then thinking about how do they actually crystallize into ideas for the paper. And that's, I guess, again, where you start to have a little bit of what I would call top down. We kind of knew that the paper wanted to pick up on the notion of ideal worker, which I've written quite a bit about. For in case you don't know, the ideal worker is this notion that the ideal worker is somebody who brings their whole selves to work unencumbered by anything such as fatigue, health problems, anything as dirty as a caring responsibilities or a life outside of work. You're just there for work and you're constantly productive and are constantly 100% on. I've been critiquing that very neoliberal concept throughout quite a bit of my work. And it really struck us that when actually we looked at, making sense of all the themes in menopause, the ideal worker would be framework would give us a fantastic way to investigate that further. And then, of course, the final stage is actually writing the paper, which is is great. So I should have said this at the start. The paper is with one of the core team in Shaw, Belinda Steffan. Belinda did her PhD on menopause and the workplace. She now has the title of Menopause Queen. And I think working throughout all of this, if you're doing this, thematic analysis, having a buddy, having a partner, or a couple of partners that you can work through and you can compare with, throw ideas around, is absolutely brilliant. It doesn't mean you can't do it on your own, but it is so much more, for me, enjoyable and creative. And interestingly, as an experiment, not for this paper, but for another theme, we tried AI to see what AI would do. It was rubbish. So for me, use a human for this.
Yes, absolutely. I'm with you 100%. Did you use NVivo for your analysis?
We
I can't.
did,
So
yes.
did you try the auto coding on that?
No, no, we didn't actually. That's interesting. I've never tried it. Have you tried it? Have you? Is that
Well, you
something you
know
use?
what? My feelings about auto coding is that gives you an interesting other perspective just to see, but it's not terribly worthwhile. It relies a lot on word counts and things like that. I mean, it's
Oh,
not intuitive the way that our process generally works. I think it's hard for AI, or in that's a version of AI, to be intuitive. And so, yeah, I mean, I think it's helpful just to get another idea, but it's not, it's, they're not there yet if they think it's going to actually do the analysis for you.
no, no. And I always say, I mean, NVivo was built as an analysis tool. For me, it's a filing tool. And it's really helpful. And I could see if, certainly AI, have used ChatGPT, and I think what it does is a frequency analysis. So if there's a theme, every time somebody talks about menopause, and it could do then menopause symptoms, it can do to that level. And that may be helpful, and certainly the code I could see helpful at that stage because it puts things into buckets that seem sensible. But you're absolutely right about that intuitive. And I think what we're really trying to do here, and goes back to your first question, or one of your first questions about why qualitative, is that you're trying to make sense of the whole person. So quantitative is good at and you can do obviously quantitative analysis where you're looking for intersections, but it doesn't really give you that view of the whole person. And I know, this project, which is interdisciplinary, obviously has real resonance for public health. And there's a real call in the UK now for health and public health that has to stop being just, symptom based and sort of mono-focused, and actually think much more holistically. And I think that's where that going through the steps of Brown and Clark really help, because they encourage you to adopt, a very much a holistic focus.
Yeah. That's great stuff. Thank you. So I was also fascinated by the way you presented results in this paper, because a lot of people will present their results sort of theme by theme, and in this case, you opted to use vignettes.
Yes.
Um, and I thought that was a really creative way to sort of tell the story of your results. And I wondered if you could talk a little bit about that.
Yes, indeed. Well, first of all, I want to say thank you to Belinda, my co-author, for convincing me to go with that. I had tried to use vignette analysis, back in a paper I was doing, I think in about 2015, and the reviewers hated it in the paper, and I reverted to more classical thematic analysis. But in discussion with Belinda and going through that Brown and Clark, the reason we felt that vignettes were more appropriate here was that focus on the whole person. So one thing I haven't mentioned was when we were doing the interviews, they were, as say, semi-structured qualitative, but we also used life grids. because we wanted to get a sense of what had gone before and how that shaped where people are now and where they might go in the future. So Life Grid was a very simple row by column matrix, and we divided periods of life into 10 years. We started from when a person had left full-time education, and then just recorded every 10 years what developments have been in their family and relationships, in their health, in their jobs, where they lived, and anything unexpected that has thrown them off course. And that was, it was a lovely technique to get to know people. So when you were talking earlier, asking me earlier about the online and the in-person, I think whatever you're doing, it's a lovely way to establish rapport because people love talking about themselves. So it was really good for that. But also because we had all this very rich information, just to present that in thematic analysis, we thought would not do it justice. So we felt that going by vignettes, whereby we could really encapsulate a rich picture of how the person had got to the stage they are at now, which might explain their behaviours, their attitudes, and their decisions, would be really important.
Yeah, we've covered a lot of ground. This is all great stuff. One of the things that I was wondering about is the vignettes that you chose. I was just wondering if you had any concerns about participant confidentiality and your thoughts about that.
Yes, yes is the short answer. And what we considered several things. What we wanted were vignettes that were encapsulating wider experiences. So these were not just taking three people at random from the 80. This was very much in saying that the themes that we had identified going back to the Brown and Clark process, the themes that we had identified and wanted to illustrate and bring together through these vignettes, we wanted to say, yes, this is this person's story, but it encapsulates these broader themes. So we wanted to choose vignettes that illustrated the broader themes. One way of doing that, and is used, is what is sometimes known as typical case analysis, where you actually create a composite. So it's not a real person, and you create a composite. And we talked quite long and hard about that because that is one way of helping preserve anonymity. Uh, but in the end, we decided to come back to, so each vignette does represent one person. And what we had to do was make sure that we did take out any identifying information. As you will see again, if you go into the data set, there's redaction. So there's no identifying information, not just the person's name or where they work, but if they talk about their partner, for example, there's no names there. You'll know that they have children, but you'll not, say know the ages of the children. So we've really worked hard to redact any information that's anonymous. We tested that with some of the participants as well to see if they had any concerns, and they didn't. They were very happy with the information that was presented. But again, you're probably gathering that this is not a quick process. It does take time. And what I've said there probably took, it was probably 3 or 4 meetings between Belinda and myself as co-authors, and then all the work that was involved in the redaction, and then going back to participants as well. So it was quite a lot of work, but in a smaller data set, it wouldn't be so daunting.
Right. Well, you did a beautiful job. I really love this paper. I think it's very engaging. But if you had to do it all over again, thinking back, is there anything you would have done differently?
With the paper or with the project or both?
Let's say both.
Both. I think with the project, I said there were maybe too many interviewers. I think I probably had too many people in the project as a whole. As I mentioned, the project had the 2 phases. This first phase with the qualitative interviews, and then the second phase with the co-design. So that involved a number of disciplines. We had social policy, sociology, we had design informatics, health informatics, public health, business and management, which is my own discipline. So we had a lot of people working on it, and that became its own industry to manage. I think in some ways I probably didn't need quite as many, although I definitely needed a lot of the expertise that I've mentioned. So I think that's one thing, but I would still keep multiple people because of all the advantages that I talked about. And I think, in designing designing any project, it's not necessarily a complex project, but in designing any project, I think having somebody to talk to and bounce ideas off can be really, really helpful, and just to bring a different perspective. So, if you're in the middle of doing assignments and you've got a supervisor or a professor you can speak to, go and speak to them. Never hold back, because they will be interested, and they will help you sort of maybe think about things slightly different, or solve a problem. So I think it's having a sweet spot in terms of number of people. Um, in terms of the content, I think one of the things that I was pleased about was the richness of the content that we got. So this is not the only academic paper by any means that's been written from the data. And one of the reasons we wanted to make the data set publicly available was that we hope others will write from the data as well, or be inspired to pick up from this and say, do you know what, I can do this differently and I can do it better. So, if anybody does want to pick up and do research in this area, or want to speak to me further, hopefully, you'll have my details, and you feel free to contact, because this is what we call a grand challenge. It's supporting people in the workplace, and to be healthy is a challenge. It's a challenge for pretty much every Western economy at the moment, and even the developing economies are starting to age more rapidly than we initially thought. So it is definitely something, and it's not going to be solved by one project, is it? So I think if anybody is interested in this, please get hold of me. Other things that I might do differently in terms of the paper. Um, I think there are more paper. It's not necessarily do differently. There are more papers to be written around menopause. This one, as say, took the ideal worker as its sort of theoretical framing, and showed how through women experience menopause, how that could be reinforced by people in terms of wanting to hide their menopausal symptoms and not feeling safe to say disclose to the employer. It could be circumvented by saying, I'm going to reinvent myself. In that case, that was a self-employed woman that did that. And it can be directly challenged, but actually saying, no, I'm not going to hide, and I'm going to come out and I'm going to create a new ideal worker and stand up to things. So I think that was, I was pleased with what we've done within that framework, but I think there are other papers to be written, and are indeed we are working on. So, for example, what about psychological safety within organisations? And then it's fair enough identifying the problems. How do we go about fixing the problems? So another whole strand of work is we've been trialing various what we're calling interventions, and if you read the chapter that I understands you're given as optional reading, you will see some of these interventions. So, for example, we've been working with a charity to train up line managers to make them more aware of age issues within the workplace, including health and age. And that's been really enjoyable. So it's not really do things differently, but it's more thinking about things that might come out of it and what we might do.
Yeah, that's great. Well, we're reaching the end of our time. So I just want to check and see if you have any advice to people who are new to qualitative research. What would you say?
I would say take your time and plan. Don't run in. Take your time, really think about who you want to speak to and why. And there's not that there's a right or wrong, it's the why, I guess, is really important. So if you've got your research questions or your aims and objectives, think about who you want to speak to, first of all, that would help you answer those questions or achieve the objectives. And then I'd say take your time in designing a good, whether it's a structured, a semi-structured, or a complete unstructured um, schedule. Take your time with that. Pilot it. That's maybe something I haven't mentioned so far, but we piloted this. Do pilot it. Allow yourself time for that. Pilot doesn't have to be a huge number of people. A couple of people can work really well. And then allow yourself time to go through the stages of data analysis.
Excellent. Well, thank you so much, Dr. Loretto. This has been wonderful. I've really enjoyed talking with you. And everybody in the class, take a look at the data. It's on the Canvas site as a resource for you. And it's fascinating to look through a complete data set like this. So please take advantage of the generous sharing of all this wonderful data. So thank you again, Dr. Loretto. It's been a pleasure.
Thank you very much. And as I said, it's I've got into research because I'm passionate about sharing and teaching and trying to develop the next generation of researchers as well. So if this has inspired anybody to think about doing some work in the area, that's brilliant.